how to scan the kidney, normal kidney. We place the probe. Now, patient supine. First, if you're seeing the patient in a supine posture, you will be working about in this region. This region is this is the subcostal region, and these are the intercostal spaces. These are the intercostal spaces. This is the lower margin of the subcostal, right subcostal region. So from the right subcostal region, you will place the probe in this region, and in the intercostal space, which is the 10th intercostal space, and you will move the probe towards the caudally. You will move the probe caudally if required, or angle the probe a bit in 90-degree angles to the intercostal space. Now this is the subcostal region. Okay, now and these are the intercostal spaces. If I place the probe here, I get the kidney getting rid of the angling and pivoting in this direction. I get the kidney in total in longitudinal section, and from here, where I get the kidney in longitudinal section, total kidney, I will give a 90-degree probe, and I will get the transverse section of the kidney, and then I will move the probe capilloid and then caudally to see if there is any pathology I am not missing. So now let's see from the same location what I have showed you. Lower right subcostal region is giving me the kidney in longitudinal section in total, and here I measure the kidney, anterior posterior diameter. This is the anterior posterior, this is the length, this is the anterior posterior diameter. Normal kidney, normal parenchyma, less than that of the liver. Pyramids are seen, central sinus echo complex is normal, no focal lesion. Now this is the longitudinal section, and the one thing to take care of is, if you can, that you see that the kidney is moving with respiration and gliding over this psoas muscle. This is the muscle, and the kidney glides over this muscle. And see where I am. This is my location. This is the subcostal region, and I am in the intercostal space. Because I am getting the kidney even in this direction of the probe completely in total, that's the reason I don't have to go upwards or downwards or maneuver the probe, angle the probe. Now from here I have turned the probe 90 degrees, and see, I get the transverse section of the kidney. This is the transverse section. I was here, I gave it a 90-degree angle, and I got the transverse section of the kidney, where I can see this right renal vein entering the kidney. This is the transverse section of the kidney. Now just for academic point of view, move the probe caudally and then capilloid, so that we do not miss any pathology in these areas, in any area of the kidney. Similarly, while we are scanning the kidney with patient in supine posture and seeing the longitudinal section, we will again do the same maneuver for little movement, cephalic movement, and note that we are not missing anything. So this is regarding the study of the kidney, right, normal right kidney with patient in supine posture. Now let's see that we can get the kidney in from the subcostal region. Now turn the patient in the left lateral decubitus posture. Place the probe in the subcostal region. Here, this is the lower end of the subcostal region of the patient. And then angle the probe capilloid here in this fashion and move the probe downwards or upwards if you require, if you need so, and ask the patient to take a deep breath and hold it if required. Now see, this is where you were seeing the probe, and this is here I am getting the kidney in total in longitudinal section with patient in left lateral decubitus posture. Now keeping the probe there, keeping the probe in the same location, I will give it an angle of 90. I will move the probe 90 degrees to get the transfer section of the kidney. If I don't get it in total, I may have to angle a bit in this direction, or I may have to ask the patient to take a deep breath and hold it. Okay, now let's see on the ultrasound machine. This is the view that we were seeing initially. I have asked the patient to take a deep breath and hold it. At the same time, I have moved the probe 90 degrees, and here you see this is the IVC, and this is the right renal vein entering the hilum of the kidney, right kidney, and this is the transverse section of the right kidney. So, again in this view, we will move the probe caudally and capilloid to see if we are not missing any pathology in this area. So this is the second way of seeing the kidney. Now there is one more. There is one more method of seeing the kidney in case if you are in problem, and that is ask the patient to lie in prone posture and place the probe in an angle in this direction, and then angle it towards the lateral side, towards laterally, to get the kidney. Now, there will be some angling. If you will not get the kidney in this perpendicular part, you will have to angle the probe a bit to get the kidney in total. And this, as this will vary with patient to patient, so you should remember what's essential. Here you will get the kidney in this region, and you will angle the probe laterally to get the kidney in total. Similarly, if from here, where you are getting the kidney in total, you give the probe a 90-degree sweep, you will get the transfer section of the kidney. In case of this side, left side, again you will. This is the vertebral column. There is the probe with a bit angling. Move upwards, and again you angle the probe laterally to get the kidney in total, and then give the probe a 90-degree probe from where you are getting the kidney in total. So now let's see on the ultrasound. Now here I am. This is where I am getting the total of the left kidney in prone posture And now I've given a 90-degree sweep to the probe, and here I am seeing the transverse section with iron. These are the hydro vessels, longitudinal and transverse. Now the next kidney, the other kidney, there, straight away I am getting it by placing the probe where I showed you. Now 90-degree angle from this region, and here I get the higher region. Now this is plasma area only in case when the patient is thin and lean. In fatty patients, you may have to have a little different plan and scanning plan. And if the liver is in line, the kidney is more easily, you get the kidney more easily. Now let's see the left kidney. How do we scan the left kidney? Ask the patient to turn to in the right lateral decubitus posture. Again, place the probe in the intercostal space just above the left subcostal region. This is the left subcostal region. Here I am in the 10th intercostal space, and from here I am moving upwards, angling the probe towards the medial side, towards the right side of the patient, and I get the kidney. See here, a little bit you may go upwards, downwards, angle a bit, and again you will see that this is the muscle, left source muscle on which the kidney is gliding. This is a normal kidney gliding over the left source muscle. This is the longitudinal view. Now in the same location, when I give a 90-degree angle to the probe, I see the hilum of the kidney. This is the hilar vessel, left renal vein entry. These are the vein, this is the artery. So little bit of maneuvering is required at times.